Fantastic. Good morning, everybody, and welcome to what is a familiar place. It's the RFS headquarters, but during the duration of the coronavirus challenge or crisis, whatever word you want to use it, this will be the hub for New South Wales. In here you can see already representatives from 20 odd different government agencies coming together to make sure we have a whole of government response across the community in relation to this issue. Can I thank the community also for responding well after yesterday's announcements about public gatherings and also in relation to social distancing. And I want to remind people how important it is for all of us to maintain that social distancing. It was good to see today in my own community people out and about doing what they normally do. Some were practicing social distancing better than others. Can I remind everybody, if we're going to really contain the spread of this virus, all of us have to play our part, and that means social distancing in the workplace but also out there in the community when we're going about doing what we do. But can I thank in particular Commissioner Fitzsimmons, who when I rang to say we need to use your headquarters, not only obliged but has helped coordinate to make sure everybody is here together. Can I thank all the agencies, especially Health, for bringing all their relevant people here so that this is our hub, this is where we'll communicate from, this is where we'll provide the public that vital information, this is where our Chief Medical Officer Dr. Chant will be based, so she'll be able to provide that timely information to all of our citizens. I also want to thank Deputy Police Commissioner Gary Warboys, who's with us this morning. Gary, as you know, is head of the State Emergency Operations Centre. That's already been located here. They were the first ones to move across. So what you see here today is the complete integration of police, health, education, transport, and many, many other government agencies working together to provide safety to our citizens, but also important information in a timely way. You'll also see on the screens behind me up-to-date information on what's going on. All of our experts in this room who are coordinating a whole of government response will have that data and information at their fingertips. And we're also already anticipating the next phase of the virus. We're making sure as best as possible that our actual hospital system is prepared. So whilst we are still in the phase of preventing the spread in the community, of ensuring that we keep people aware of what they need to do to prevent the spread, that we're already focusing in a huge way on preparing the health system for the next phase that's likely to occur. Can I also thank the Minister for Health in particular for supporting us in this big integration move. It's been a big operation moving 20 odd agencies and different parts of government into the one headquarters, but an important and vital step to make sure the community can see and we can demonstrate a whole of government approach where every expert, every person who is the best at what they do is giving the government the best information every single day, and I look forward to being able to regularly brief the community on important updates.
Thank you, Premier. So as at 11 a.m. today, we have 307 cases of confirmed COVID-19 infection. 129 of these were acquired overseas, and in recent weeks we've seen an increasing trend towards returning travellers from the UK, Europe and also US. 59 contacts of confirmed cases, and that reflects the importance of our public health measures about making sure that we self-isolate the cases and also quarantine the contacts. We have a further 70 cases under investigation and 46 cases where we believe local transmission has occurred. It's reassuring that many of our cases continue to be mild, with currently 6 patients in intensive care units. Many of our patients are being managed in the community and being managed at home, and we are only admitting patients now that require hospital care. Whereas in the beginning, as we became more familiar with the management of this disease, we took a precautionary approach in admitting them to hospital, despite the fact that many of them did have mild disease. We've had 5 deaths in New South Wales, and there are a couple of public health alerts that I'd like to put out now and get them disseminated to the community. So in relation there was an event between University of Sydney and University of Queensland rugby clubs. And it was held on the Sydney University football ground function room on Saturday the 14th of March, starting at 7:30 and finishing at 10:30 p.m. All people who attended this event are considered close contacts of a confirmed case, and we ask that any attendees immediately self-isolate themselves for 14 days. So that will be until midnight of Saturday the 28th of March. And should anyone develop symptoms, please contact the public health units on the appropriate numbers. There is guidance on our website in relation to what you need to do to self-isolate yourself, but please don't hesitate to contact us if you need further details. We will continue to make efforts to contact people directly, but we are making a public announcement in relation to the need to self-isolate. They're probably the most significant updates, but also happy to have any questions. It was 307 cases. We're working closely with our colleagues in the Commonwealth who are responsible for the borders. The Commonwealth have undertaken to ensure that there's strong messaging that anyone who is sick at the borders should be present, and New South Wales Health has a presence at the border, and should anyone have any symptoms, they will be directed to the health services for assessment. The current advice is that people should proceed directly to their home through whatever means and then self-isolate. But as I said, those precautionary approach at the airport is to really encourage any returning travellers who have symptoms to be assessed prior to any ongoing transport. Every day we update you on the number of people screened at the airport and also the number that are referred for testing. We are following up and we are working in a whole of government way to ensure that people are doing the right thing. And I would like to reassure the community that our information when we have follow-up to people in self-isolation, and as I said, we have daily contact with those close contacts that have been put into isolation, is that it's pleasing to see that the vast majority of the population are incredibly compliant with our public health messages. And I would like to just reinforce the importance of complying with the public health advice. And if there are breaches in that, we work in a whole of government way to ensure that action is taken against people who should breach. We just urge you to think twice before putting anyone else at risk and breaching that public health advice. Look, I'm not sure on that, but from the reports to me, it's clearly a large function. This is very precautionary, and it occurs in a function where we basically can't really identify very clearly how groups moved around in a space. But we have got evidence from some other gatherings about the importance of really these gatherings for onward transmission. So we do urge everyone to take our public health advice seriously and please self-isolate yourself. Yes, but through the normal approach, in terms of whether there's interstate, we will get these messages out more broadly and work with our colleagues. This is a very collaborative approach across states and territories in the Commonwealth. On a daily basis, we are sharing relevant information with our colleagues across Australia and, including New Zealand and across the world where it is necessary. So it's 40 cases since we last updated the media yesterday. Sorry, fentanyl? Ventolin. So obviously we've been advising I'll go back to the first one, is it is important at this time that you have your asthma medication coming into the colder months when we are expecting flu and other respiratory viruses to circulate. It is also an appropriate time to update your asthma management plan. The issue of Ventolin availability has not been raised with me. We do think it is prudent for asthmatics to always have their reliever medication and have an asthma management plan, but I will follow up in terms of the stock holdings of Ventolin. The WHO advice, it hasn't been brought to my attention, but clearly we have been advising Panadol for the symptom relief. Let me be clear, because there has been some social media misunderstandings that Panadol is a treatment for COVID-19. Panadol does not treat COVID-19, it treats the symptoms, which might be fever, muscle aches and pains. Not at all. The Australian Health Protection Principal Committee met on Monday and Tuesday to consider all of the evidence. At this point of where we are, we do not recommend school closures. And instead we have recommended to government, which government have taken that advice, to introduce a range of social distancing measures. And I think that is highlighting the advice around the importance of social distancing to slow the spread of the virus in the community. So the AHPCC considered its advice in relation to aged care facilities and did indicate that we would permit 2 visitors per day, but we also urged aged care facilities to look at other ways that they can keep their residents socially connected through iPads or phone. It is very important that we support our elderly at this time. We know they're particularly vulnerable to the effects of COVID-19, and we are very concerned with aged care facilities, but it is important as well that we manage the quality of life of our residents, our dear loved ones in aged care facilities. And so we will work and the Commonwealth is doing a lot of work with aged care facilities to get that balance between meeting the needs of aged care facility residents for social connectivity, but minimising the risk of COVID-19 in aged care settings. So again, this is a time where the community has to pull together. It's a time when we need to keep our elderly safe, but we also need to ensure that we're supporting them. So simple strategies about ringing them, checking in on them, dropping by, having functions. If you're going to go and meet with them, sit in the garden, sit in open places. Make sure you don't visit your elderly relatives if you're unwell. But I would encourage families at this time to actually talk amongst themselves about what is their strategy for protecting elderly people. We have thought about infection control very significantly, and hence spacing between desks. There's empty gaps, and so we're trying to keep people as separated as we can. And it's pleasing to see the media is also a bit socially distanced. Some of our requirements on them, also our discussions that I will leave it to the media team later on to talk to you about, is not having you clustered and put in a small space. So we need to work through. This is a time where all of us have to reflect on our behaviours and practices to minimise the opportunity for the transmission of this virus through the community.
Yeah, absolutely, and thank you. Gary Warboys, Deputy Commissioner of Police New South Wales, and I take on the role as the State Emergency Operations Controller. In that role, what we've seen here today is health. The combat agency now supported appropriately by other combat agencies and also functional areas to provide a whole of government approach to to looking after the people of New South Wales and ensuring that the spread of this disease is minimised, and people right across this state should take great comfort of what we've seen here today. And I think the people in this room are in fact leaders in each of their disciplines, and provide me with a great deal of resource together with Dr. Chan and others to do the very best for the people, and the people should be confident that from here on we have a very coordinated and highly professional response. My role here today is and ongoing is really about supporting health, about providing solutions to problems and consequences as a result of what health are doing to bring us through this crisis.
Look, I want to reinforce the message that was given to the community so strongly yesterday. There is no need, absolutely no need to panic buy or hoard. We are ensuring there's a solid supply chain, and we also want to make sure those most vulnerable who can't go to the shops every day because they're immobile or they're older or vulnerable do have that support as well. So please be a good neighbour, be a good citizen. Do not panic buy, there's no need to do that. And today I have noticed a slight shift in the community. I have noticed people resuming normal activity with good social distancing, and I'm hoping the message, it might take a bit longer than 24 hours to get through, but I do see hope of it getting through. Please stop that activity. It's not necessary, it's not needed, and it's very, very un-Australian. But in the main, I've certainly seen people today adjust their behaviour. The social distancing provisions are being respected, but each of us does have a responsibility to do the right thing, because we don't want to have to monitor everyone's behaviour every minute of the day. That's not what this is about. This is about saying to people we're at a very critical phase of this crisis. We are in a phase of controlling the spread, making sure we know where the cases are, making sure who the contacts are. We don't want to lose control of the situation. That's why everybody has to play their part, irrespective of what you do in society, whether it's supporting the most vulnerable, whether it's making adjustments to your own life, as all of us have had to do. Nobody is excluded from this. All of us have had to make adjustments. And if we carry on in that way, we can not only control the spread, but make sure we can continue in this way and provide people the opportunity to move around freely at this stage. Well, for us, what pleases me to date, knock on wood, as the Chief Medical Officer reported, we have a very small number of people that have required intensive hospitalisation. The vast majority of cases have only shown mild symptoms. They're treated at home as they would for any other mild illness, and that's a positive, and we want that situation to continue. We don't want to see an escalation in the number of people who need intensive care in hospitals, and that's our aim, to keep that number down. And you can do that by reducing the spread and especially protecting the most vulnerable, and all of us have a role to play. We know already that for many people the symptoms aren't even evident and they're carrying the virus, and that's why all of us have to assume we have it. So you have to act in a way as though you have it, and how you won't transfer that to other people. Yeah. Well, that's something New South Wales has already undertaken, so we're saying to all councils and everybody else, do not worry about those restrictions. If some of us have, I live near a supermarket, if some of us have to put up with trucks delivering goods in the middle of the night, so be it. Yeah, no, we accept that, and the planning minister's already onto it, so we've already undertaken the path to that. But our strong message is all of us have to change and accept things a bit differently, and if that means trucks delivering supplies in the middle of the night, well, that's a positive. This is a time when we have to firstly come together, but secondly, take the advice of our health experts. I don't know who made that comment, but chances are they're not a doctor. Last time we looked, they didn't have medical qualifications. This is not a time where you make it up as you go. This is a time when we listen to the health experts, we take their advice, and this is a time when all of us come together, and in the main that's occurred, and I'm grateful for that. great question. In fact, Commissioner Fitzsimmons has already put in place a plan. We anticipate around a 3-month overlap, so he's already put in a contingency for that. And I'm deeply grateful to Commissioner Fitzsimmons, because not only did he give up his headquarters, but he's also been instrumental in helping with the integration. We've relied on his logistical expertise to help us do that, and we already have a plan in place, because we do anticipate an overlap between this and the fire season. Mind you, during that time, we will still need to coordinate those messages in an integrated way to the community, because to manage that type of fire season in the middle of a crisis, a health crisis, is also challenging. So that will be completely integrated.
How many what, sorry? We're doing what we're doing with all of the other frontline health staff, and the paramedics are being given special advice on how to actually approach these cases. But the majority of these cases are actually not coming through the paramedics at the moment. They're actually coming through normal health channels. So people the majority of the numbers still remain. I think it's about 44% last time I looked of people who came in with this virus. Slightly less percentage who have had it transmitted, but that's still a substantial percentage. And of course there's a group that makes up the balance who are unknown at this stage or being investigated. So the health staff, particularly through our respiratory clinics and our emergency departments, are extremely well versed and extremely competent in how to safely work with people who perhaps have the virus. And certainly, as I've said many times, our health system in this state, and indeed in this country, is, in my view, the best in the world. And the frontline staff deserve all of our thanks, because they're incredible. And I just want to say again, thank you on behalf of the government and the community to every one of our frontline health staff. It's not just the doctors, it's not just the nurses, it's the allied health staff and the paramedics. But they're all well trained and they're doing their job, and I thank them. I'll let the Chief Health Officer answer that, but we did have one Year 7 child who was 12, we had 2 Year 10s, and I think we may have had 1 or 2 more. So Dr. Chan, you've got the details of that?
I think the details we reported was the youngest was 6, but I'll just need to confirm that with you. And that's basically because there weren't any cases under 10 at that time. We will update the data today. Consequent on this press conference, we'll be updating the data daily, and that has the age breakdown on the website. I just want to double check that, but the reason the cutoff was 10 to 20 was because of the issue that there were none at that time.
Thanks very much. Thank you.